Hi, my name is Chris McKay. I'm Professor of Health Economics at the University of Alberta and Chief Executive of the Institute of Health Economics. And it is my privilege to be co-principal investigator on the One Society Network with my colleague, Professor Chris Cotton at Queen's. This is one of a series of webinars being given by members of the One Society Network. The One Society Network is one of 5 emerging infectious disease modelling networks. An OSN, as we like to call it, consists of research from across Canada. And we're working to understand the multisectoral impacts of infectious diseases like COVID-19 and the related public health policies within Canada. This series of introductory seminars gives an overview of the dynamic connections between pandemics and diverse aspects of society. So before we get into today's seminar, I just want to quickly review some housekeeping notes. All the participants throughout the webinar will be muted. However, feel free to use the chat to submit your thoughts, comments. If you have any questions, could you please use the Q&A function? That's down at the bottom of the screen on the right-hand side. And the questions will be answered at the end of the presentation. So, on to today's seminar. Its title is The Effect of COVID-19 Pandemic on Economic Outcomes Within the Healthcare Sector. I ask you to join me in welcoming our presenters, Dr. Ellen Rafferty and Danica Wolitski. Ellen's research focuses on the epidemiological and economic impacts of public health policies and infectious diseases, such as estimating the cost effectiveness of immunisation programmes. As co-investigator and project manager of the One Society Network, she's working to incorporate that intersectoral perspective into pandemic response. Ellen is a health economist at the Institute of Health Economics and an adjunct professor at the School of Public Health in the University of Alberta. She has a PhD in epidemiology and health economics and a Masters of Public Health from the University of Saskatchewan. Danica is interested in multidisciplinary research, particularly in the links between epidemiology and economics. She's a health economist at the Institute of Economics and an NSERC and One Society Network research associate with the healthcare research team. She has a Masters of Arts in Economics and a Bachelor of Mathematics from the University of Alberta. So with no further ado, I will hand over to Ellen and Danica.
Thanks so much, Chris. And hello, everyone. Welcome to our presentation today. So this presentation will be split up between Danica and myself, and we'll focus on some work we've done on the effect of the COVID-19 pandemic on economic outcomes within the healthcare sector. We also want to thank Chris McCabe, Caroline Koline, and Eric Wazelenko for their input into this work. So the presentation will be split up into 3 main parts. In the first part, I will provide a broad overview of our research focus, how we are framing this really broad topic, and what we mean when we say economic outcomes within the healthcare system. Then Danica will take over and provide what I think might be the more interesting part, talking about the scoping review we completed on this topic in Canada. And then we'll present many research gaps that we identified and what they mean for next steps in our research. And we're very excited to discuss with you these topics. So please put your comments and questions in the chat and in the question box throughout the presentation, and we'll make sure to leave time so we can discuss those with you. So first, I want to place our work within the larger One Society network, and I know Chris gave a good broad overview of this, which was really helpful. But in this graph, you can see that healthcare is just one of many sectors, all of which are captured in the colorful boxes. But each of these sectors are related, and a change in one sector can have repercussions for the other sectors. There are also what we're calling cross-cutting sectors in the network These are the mathematical modeling and epi groups, the economy-wide macroeconomics groups, and the marginalized populations. And these really, as I mentioned, cross-cut all the different sectors. And so while our focus, especially of this presentation and our research, is on the healthcare sector and the people, infrastructure that comprise and use that sector, we want to make sure we're thinking about how this sector is integrated with all these different aspects of society, and how changes in our healthcare system in light of or in response to the pandemic impact education, for example. You might see an increase in healthcare spending, which a lot of people are talking about, that might limit education spending, or healthcare needs highlighting gaps in healthcare worker education. So I think we will talk about a lot of the different ways this connects with the different sectors. So our specific research focus is on the effect of the COVID-19 pandemic on economic outcomes within the healthcare sector. But really, and maybe kind of the next step of that is then linking that back to the wider impacts on the economy. So we don't want to forget about that bit. So what does this mean, and how are we framing this? How are we conceptualizing kind of our research approach, and what is included and not included? And again, we're happy for any of your thoughts on this topic. I think this is all kind of new to us as we conceptualize it. So we want as much feedback as we can get. But the first step, we believe, to our work is analyzing and exploring how the pandemic has changed the healthcare system. We're not really focused on the direct healthcare impacts. So not really the fact that more cases of COVID-19 leads to more hospitalizations associated with COVID-19, but rather the more indirect effects, looking at the next few years rather than the immediate future, and how our healthcare system is going to have changed in response to the pandemic. And then once we know the healthcare impacts, we can start to think about the effect on the wider economy and frame how these changes in the healthcare system will lead to changes in the wider economy. And we know that healthcare plays a big role in the economy, both based on the impact associated with health and the impact health has on the economy, as well as being a major employer, a major section of the economy. But there are a couple things that we won't be covering that might interest you. The first one is we aren't really looking at health or the pandemic directly relates to the economy. For example, the number of long COVID cases and the impact this might have on labor markets and people not being able to work. Well, this is all very interesting. We have other groups in the network who are looking at this. And if you haven't had the chance, the first seminar presentation, the first OSN seminar presentation was on this topic, and it's posted on our website. So we have groups looking at that, and it's really interesting, but we won't be covering it here. The other thing we're not looking at is the impact of the economy back on health. So going through the literature for the scoping review, we noticed quite a bit of research focused on the impacts of the economic downturn associated with the pandemic on health and mental health. And while, again, a very interesting topic, we won't be covering that in the research. So really focused on how these things work through the healthcare system. So now to break down what we mean in each of these categories. So when we speak about the pandemic, we're speaking about the COVID infections, both the ones that were, observed and the ones that were not observed. Cases, hospitalizations, ICU visits, deaths, and long COVID. So all the different elements associated with the pandemic. And these will impact economic outcomes within the healthcare system through infectious disease control strategies. So some of these include kind of socioeconomic control strategies, health policies, especially health policies within the healthcare system. So how COVID-19 patients are treated within the healthcare system, how they're prioritized, the trade-off between COVID-19 healthcare and other healthcare. So how healthcare is prioritized within the healthcare system, whether that is, especially during kind of constrained parts of the pandemic, and how that was dealt with. And then individuals' habits and behaviors and how those might change other aspects associated with healthcare, increased hand washing, masking, and how these might change over time. This then alters the demand and supply for labor and expenditures and resources and infrastructure within the healthcare system, raising questions about where supply might not be able to meet demand and where we may have to fill gaps in our healthcare system in the future. These then link to the broader economy, so GDP, government spending, through public funding, government policy, the markets associated with healthcare and the informal economy. So you can see there's still a lot to unpack here. So to dive a bit more into the economic outcomes within the healthcare system that we are going to explore. But before we do that, it's important to remember that healthcare is only one piece of a larger economy. And this is kind of related back to the whole vision of the One Society Network. But if you increase the piece taken up by healthcare, as a lot of people are talking about increasing spending in healthcare, or have been doing for many years, there may need to be some give and take in other parts of the economy, taking funding and resources away from other sectors. And specifically, when we're talking about economic outcomes, we talk about healthcare labor, healthcare infrastructure and resources, as well as healthcare expenditures. And these are kind of broad categories that we use. Some things might not fit as well into these categories, but they capture a lot of the elements. So to dive into each one a bit more, so what are we talking about when we talk about health labor? Well, of course, we mean healthcare workers, doctors, nurses, and then specialties within these fields, long-term care, ICU, but we also mean support staff and parahealth professionals and administrators and educators. So it's quite a broad group of people that we're talking about. And I think it's important to start to think about, and even in your own fields and your own experiences, the impact that the pandemic could have had on these labor markets. So some of the key concerns that we have noticed are the concern around burnout and retirement following the pandemic or during the pandemic, a changing skill mix. So people had to take up new skills during the pandemic. How does that apply, and how do we use those skills moving forward? And then reallocation of tasks to different roles. So we saw that again and again during the pandemic. And are those people who took up those new roles going to continue on? Or do they need different roles? And is the system we have in place appropriate to the needs? So that's health care labor. The next grouping, and a really important part of the health system, is infrastructure and resources supporting the system. So things like PPE, long-term care facilities, ICU, and hospital beds, everybody's favorite topic. And we know that COVID-19 impacted these things. We also think it's important to recognize that while the pandemic may have identified some weaknesses in our infrastructure and resources, and I think we all have ones that immediately jump to mind, we don't want to forget about some of the opportunities that were created and that might be used moving forward as we, and I don't like to use this because it's not really accurate, but as we get back to normal, and I say that with the biggest air quotes possible, but we have some opportunities presented in the infrastructure we invested in for the pandemic that can be used for other areas of health. Things like the virtual care platforms that were set up, wastewater or other types of surveillance systems that were set up. And my personal favorite, based on my background, vaccine registries. So there's a lot of places in this country that didn't have very good vaccine registries for the whole province. Tracking of vaccinations was very difficult. And this might present an opportunity to piggyback on some of the infrastructure that was put in place for COVID-19 for other vaccines. as one example. Then we can talk about expenditures. And expenditures kind of sound boring, but they're actually where some of the biggest changes might be happening. So fee-for-service remuneration, how has that changed? How has that changed in terms of, virtual care? Federal and provincial cost sharing, publicly funded treatments, insurance. And a few examples that jump kind of immediately to mind when I hear about these things are things like long-term care. So the push to move from private to public funding, maybe not push, but the consideration of moving from private to public funding. The federal payment for things like antiviral drugs and tests and vaccines that didn't really happen on that scale before this. So, I mean, some of the first instances of non-hospital drugs being covered by the federal government. What does that mean moving forward? Do we want to expand on that? Do we want to just return completely to what it was before? So those are just a few examples that I want you guys to keep in mind as Danica talks through some of the specific literature that we found on this topic in Canada. And I'll hand it over to Danica.
So I'm going to take you through the scoping review that we did. So the focus of our scoping review was, again, going back to what Ellen talked about, the effect of the COVID-19 pandemic on economic outcomes within the healthcare sector. And so our scoping review specifically looked at studies within Canada. And the purpose of this review was to find existing literature in this area, more importantly, to pinpoint research gaps and inform the direction of our research moving forward. So again, going back to the framework that Ellen talked through, the different articles that we've included in our review include articles that focused on the effect of the pandemic on the healthcare economic outcomes, but then also articles that talked about that effect on the broader economy. So some of the methods that we used for our scoping review, I'll outline here. So we used 4 different databases: Medline, Embase, EBSCO, and PubMed. In the next phase of our scoping review, we will be looking at gray literature, but in this initial phase, that was not included. So we used 4 key search terms: COVID-19, economics, healthcare, and Canada. We also used synonyms for each, as well as names of provinces and capital cities to make sure that we captured any articles surrounding that area. We included articles with publication dates between January 1st, 2020, and then February 17th, 2022. And our scoping review consisted of 2 different phases. The first phase, we went through title and abstracts. The second phase was a full text review. In each of these phases, we had 1 reviewer for each phase. Just a note, the individual articles that we included in our scoping review were not reviewed for research design quality. So anything that seemed reasonable, that was in the area of our focus, we have included in our review so far. So we use an inclusion criteria looking at population in Canada, English text, articles that focused on the effect of COVID-19 pandemic, any associated control strategies with the pandemic, as well as a focus on the impact of the pandemic on economic outcomes and within the healthcare sector. A few of the things that we excluded are conference abstracts, news, commentaries, opinions, interviews. Again, we were just mostly looking at observational study designs and something where we had more direct evidence for what we were looking for. So after applying our selected search terms and publication dates, to the 4 different databases that we searched, we ended up with 253 articles meeting our criteria. After the phase 1 abstract and title review, we ended up with 78 articles meeting our criteria. And then after the second phase review of full text, we ended up with 22 articles. And we will dive further into these 22 articles in the next couple slides. So just to point out, one of the most significant research gaps that we're finding is, of those 22 articles that met our criteria after the phase 2 review, all of them looked at the effect of the COVID-19 pandemic on changes within the healthcare sector. None of them linked the changes in the healthcare sector to the broader economy. And another interesting gap that we found was where different studies took place within Canada. So of those 22 articles, we had 7 that were national Canadian studies, 11 based in Ontario, 1 was based in the Yukon, 2 were in Alberta, and 1 was based in both Alberta and the Northwest Territories. This is another interesting research gap that shows where research can go from here to kind of look at the difference across provinces. Next, I'm going to go into a high-level overview of the results from our scoping review. I'll describe some of the changes in demand and supply of the economic outcomes in the healthcare sector. First, I'm going to look at changes in demand of labor. So general themes that we've seen is an increase in COVID-19 testing labor, but then also a decrease in family physician and custodial labor. For expenditure, we identified decreased or increased demand for expenditure in virtual care, but then decrease in virtual care physician remuneration. In terms of the infrastructure and resources that changed within the healthcare sector, we noted, an increase in demand for virtual care infrastructure, COVID-19 testing, and different treatments for COVID-19. We also noticed a decrease in the demand for antibiotic prescriptions and physical clinic space. On the supply side, we noticed a decrease in nursing labor supply, and the article that references this notes decrease in nursing labor because of nursing labor shifting to other areas of the hospital like ICU. In terms of expenditure on the supply side, we see a decrease in virtual physician remuneration fees. And lastly, in terms of supply of resource and infrastructure, we see an increased supply of virtual care and COVID-19 testing. Then we see a decrease in non-COVID diagnostic tests, elective procedures, and hospital beds. So this graph again kind of shows us another gap in the literature. So we see quite a bit focusing on changes in demand in our economic outcome categories of labor, expenditure, and resource and infrastructure, but a lot less focusing on the supply changes of labor and expenditure. The main theme that we've seen in the literature is delay of care due to COVID-19. Now it's a special case that doesn't entirely fit into one of the categories of labor, resource, infrastructure, and expenditure, but instead changes within these categories affect delay of care. And when we talk about delay of care moving forward, we're talking about both diagnostics, procedures, and treatments. So building on the last slide and diving into delay of care resulted from the decrease in healthcare capacity due to the COVID-19 pandemic, infectious disease control strategies, as well as fear of viral transmission. The majority of the papers that touched on the delay of care were generalized, but the articles that focused on specific areas were in the area of cancer, inflammatory bowel disease, and family medicine. So delay of care was seen in areas of outpatient, inpatient, and diagnostic care relating to cancer, and then outpatient and diagnostic care related to inflammatory bowel disease. So the articles listed on the bottom are for reference afterwards, if anyone is interested. Those numbers correspond to the number of the reference that touch in this area. And then moving deeper into the economic outcomes associated with delay of care that was presented in the literature. And note again that the numbers on the end of each bullet represent the number of the reference that talks about each of these topics. So these slides will be posted on our website, on the One Society Network website, as well as a presentation after today. So you're welcome to go back and look at the different things that we've found in each of these sources. So some of the acute pandemic decreases in economic outcomes that we've seen in the literature relating to delay of care include in-person clinic visits, elective procedures, inpatient, outpatient capacity, diagnostics, and oncology referrals. Those have all seen a decrease during the pandemic. On the other hand, although not surprising, we have seen an increase in cancellation of procedures, increased surgery wait times, increased drug and equipment shortages, and supply chain disruptions. So again, this focus on acute pandemic changes and the absence of long-term consequences in the literature presents another interesting research gap. So moving to the next big theme that we noticed in the literature of virtual care. So the implementation of virtual care was accelerated due to the pandemic to combat the decreases in capacity for in-person clinical care across Canada. So a lot of places across Canada had virtual care infrastructure, but it was not utilized to the extent that it is now. And a lot had to build infrastructure to accommodate the volume of patients moving to virtual care. So a lot of the papers, again, focused on family medicine in terms of the switch to virtual care. However, a few that specialized were in mental health, epilepsy, cancer, inflammatory bowel disease. So diving into more of the specific economic outcome changes associated with the shift to virtual care. So some of the increases that we're seeing include virtual patient volume, virtual infrastructure, and the integration of existing digital infrastructure with better data reconciliation and ease moving across different platforms. On the other hand, we're seeing overall patient volume decreasing. So this includes in-person and virtual patient volume. The need for physical infrastructure is decreasing. Physician remuneration fees, specifically with community care and family physicians, has decreased. And then as well, we're seeing a decrease in quality of care when it relates to walk-in clinics. Also want to touch on the idea of inequity within quality of care. So because of the nature of virtual care and needing access to the internet and devices to access that, we're seeing an increase in inequity within care across Canada. The only long-term consequence that was identified in the literature was the decrease in family medicine doctors that may result from the decrease in remuneration fees associated with virtual care. Again, this shows a pretty big research gap in terms of long-term consequences. A few more article topics that we thought were a little bit interesting and wanted to share was in the area of COVID-19 PCR testing and the increase in virtual community health care as a form of virtual informal care. So a study by Campbell published in 2020 estimated the costs associated with the COVID-19 testing of various groups. It found that it would cost anywhere between 2.3 million and 45.6 million for one round of COVID-19 PCR testing across Canada in each of the respective groups. And then moving on to the second topic, so virtual community care was implemented and run by community volunteers. It was delivered through Facebook groups across Canada, and we noted a few themes within those Facebook groups of sharing COVID-19 information and as well as offering support. So going back to more research gaps, in terms of the theme of delay of care, a few of the research gaps that we thought that we identified during our scoping review include the estimation of the magnitude of care and diagnostic deficit, and how labor, resources, and infrastructure, as well as expenditure, needs to change in order to resolve the care deficit. This includes changes in regulation and funding types. And then some interesting questions to think about in this area are, do healthcare funding structures need to change? And is it feasible to shift resources to address the care deficit? A few more to focus on inequity. So is there inequity within the care deficit? Who has been impacted the most? And are there solutions other than virtual care to combat the delay of care? And now going back to virtual care, these are some of the bigger research gaps that we identified as well. So what changes in demand and labor resulted from the shift to virtual care? Has labor demand changed for educators, IT staff, support staff? What changes in infrastructure and resources occurred with the shift online? Are there increased needs for data, security, IT, infrastructure? Has inequity in healthcare been exacerbated due to the implementation of online health services? And finally, what are the risks of virtual care? I'm going to hand it back over to Ellen, and she's again going to talk about some of the more general research gaps that we've identified.
Thanks, Danica. Yeah, so I thought I'd jump back in here because this is kind of the thing that I think both Danica and I are most excited about is the research gaps as researchers, I guess, probably. And I think there's so many here that we want to pull out and discuss, and we probably even miss some. So we're happy to hear what you think. So one of the biggest ones that we noticed and thought was an important one was how labor markets have changed and how they should be changing to meet needs in the future. So it hasn't really been discussed in the literature to date, other than quite focused on very specific labor groups, rather than looking more generally at the health system and how things are shifting within the health system. And I actually just read a Globe and Mail article about this and a meeting of health professionals who are coming together and are very concerned about this because of the things I talked about earlier in terms of burnout and retirement and how those are going to affect healthcare in the future. The next kind of big category is funding. And as I mentioned earlier, there's a lot of unanswered questions in terms of funding moving forward and how that could shift. I gave long-term care as an example, and then federal funding and purchasing of health products, if that's going to continue, and what are the risks and benefits of continuing that. This is also related to ICU capacity, and this is a big topic in Alberta, which is probably why it's top of mind for us. But I know in Alberta, there's been a push to increase ICU capacity following the pandemic and the ability to care for more people in the ICU at once. But I think we as economists and epidemiologists need to take a careful look at the implications of this for the healthcare system and the wider economy. If we do increase funding to allow for this, where is the money coming from? Is it coming from another part of the healthcare system, or are we increasing budgets? And what does that mean for other sectors? And then maybe more specifically, is there a risk of supply-induced demand? Because where ICU beds are available, will they just be used and therefore the demand will increase along with supply? You know, doctors will think, oh, this is potentially a safer place for my patient and there's a bed available. Do I use that bed? So just some of the considerations to think about. I think long-term care is a huge gap in this literature. Now, I think Danica mentioned, or is going to mention, that we haven't captured the gray literature yet. And I know there's quite a few reports on this topic in the gray literature that starts to talk about how the system might need to change in response and in preparation for future pandemics, because that's a lot of what we're doing here, is trying to think about how to prepare for the next pandemic and how to continue to respond to this one. So I think there's a lot to think about in terms of long-term care. There's also a lot of discussions in this arena about home care and the shift to home care, but this does raise concerns about inequalities, about who will be taking on that informal care role, as traditionally that has fallen to women. So, I mean, I think this is a good place where we can see the direct impacts to the wider economy of if we are starting to think about women taking on that informal care role, how will that impact the larger economy, along with other inequity issues associated with that? Which brings us to our next topic, which is inequity. I know Danica mentioned one study that looked at inequity in virtual care, but I think there's a lot more room to expand on this. We know the healthcare system is already inequitable, and it would not surprise me if COVID-19 has exacerbated those inequities. And but currently in the literature, there hasn't really been anybody looking at this. So I think this is a big topic that needs to be looked at, as well as the solutions and inequities in the solutions being proposed. We saw it with virtual care. There is concerns around the quality of care and inequities in quality of care associated with virtual care and people's access to virtual care. So a lot to unpack there. And then getting back to those opportunities we talked about earlier, there's not a lot about testing in the lit that we looked at. You know, some broad topics, but what are the benefits of testing outside the healthcare sector more generally? So we've seen wastewater really develop as an option for surveillance and a good population-based option. Can we use it for other to test other infectious diseases? Can we use the infrastructure in place for that? How does that impact the healthcare system in the future? Similarly, rapid antigen testing, how can we use the systems we have in place? And then, of course, public health. So there's been an expansion of public health strategies during the COVID-19 pandemic. But again, there's strategies that probably, most of them, don't apply to just COVID-19. So how can we develop a system that uses these strategies and applies them and gets the benefits of them outside of COVID-19? And I'll hand it back to Danica.
Coming back to the research focus that Ellen described in the beginning of the presentation, it's one of the biggest research gaps that we've identified in the scoping review is identifying the effect of the changes on economic outcomes within the healthcare sector on the broader economy. This is really important discovery for us, as it has shaped the next steps of our research. So moving forward, we're going to look at expanding the scoping review to include countries other than Canada that with public health care funding, and also include gray literature into our searches. We will dive deeper into the changes in labor outcomes within Canada in the healthcare sector that changed due to COVID-19 to fill that research gap. And then we're going to focus on the general impact of changes within the healthcare sector on the wider economy. And then to support future decision-making in times of infectious disease outbreaks, we're going to look at methods to connect epidemiology and economic models from a healthcare perspective. And then going back to where we fit within the broader scope of the One Society Network. So we've identified some ideas to connect our research to other sectors of OSN, and these include connecting to education through changes in labor. So do we need different educators? Do we need different programs? Do we need educators to shift to more virtual healthcare means? Another link is in transportation through the changes in supply and demand. We'll touch on marginalized populations and Indigenous communities by looking at our research through a lens of inequity. And then interprovincial response. We will look at this because we're thinking of comparing different changes in these outcomes across Canadian provinces. So thank you to everyone who listened to our presentation. Ellen, Chris, Caroline, Eric, and I will address comments and questions now.
Thank you, Danica. Thank you, Ellen. That was a great presentation, covered a huge amount of ground, and we should get some questions if people want to put their questions in the Q&A. I see that Benaz has said references, please. They are in the next slides, and we're going to upload the slide deck to the One Society Network webpage, and you'll be able to download them for yourselves there. So you'll be able to get at all the references, which are a rich resource in themselves. So well, thanks, Benaz, for flagging that up. I'm just going to open up. So whilst we're waiting for questions, I'm going to do moderator's privilege and ask, were you surprised that how little, if any, literature there was about the impact on the economy, given it was such a big part of the policy conversation, that there weren't any, that you didn't find literature around that? And have you got any explanations, thoughts about why that might be the case?
I was a little bit surprised, as there seemed to be a big trade-off between, health and wealth, especially in Alberta here, and what we do in terms of lockdown strategies to preserve jobs and economic outcomes here, as well as decreasing transmission rates to preserve hospital capacity. But I think just because of the nature of the infectious disease outbreak, these studies linking, changes within the healthcare to the broader economy, I see them coming later. Well, I hope. Well, ours will come later, but in the heat of things, people were really focusing on more acute impacts of the pandemic and less long-term consequences.
Thank you.
And we did, I was hopping here, we did see a few that directly linked health and the economy. I think we saw more of those than kind of through the healthcare system. And so I think there's less consideration of that. And there might be more when we dive into the gray literature. I could see that coming out more and more in that literature. and if we maybe expand this the scoping review, which is what we're talking about. So I think there is the possibility we'll find more than we have so far.
Thank you. We've got a question. Anonymous says, you've identified some really big questions and research gaps. Besides expanding your scoping review, how or will IHE contribute to addressing some of the research gaps? Do you have suggestions on how researchers can start to tackle some of these? Do we have the infrastructure data in the province, or indeed any province, I guess, to explore these questions? So I'll throw that one at Ellen first. There's quite a lot in there.
Yeah.
Choose which bit you want to answer.
Yeah, I can just leave the other bit to Danica. It's perfect. No, I think it's a great question. And yes, we do have plans to start to address more specifically than just identifying the gaps, some of these research questions. And I mean, I think Danica can expand it a bit more because she's planning to do the work, or most of the work. But I think the focus we thought about is in those labor markets and looking at the shift, both the shift in the labor market, as well as looking more at where the need will be. And luckily, I think this ties in with some of the work that IHE might already be doing, looking in this area, looking at that care deficit that Danica spoke about, so that we can both identify where the gaps are in that, not in the literature, but in the healthcare system, as well as start to think about strategies that will kind of control some of those gaps, and then the impact on the wider economy. So that's our focus. In terms of what provinces can do, I think that's a hard question, but I do think provinces, I mean, I can only speak from Alberta's viewpoint because I know their data better than other provinces' data, but I think there is a lot of data available on, you know, how the healthcare system has been impacted. You know, I mean, Alberta has great data in terms of, you know, how hospitalizations have been affected, how all these different elements have been affected. So we can start to look at that. I think that's a good place to start. Danica, do you want to add to that?
I think you captured it all. Thanks, Ellen.
And I don't know if Eric or Chris, you have anything to add? Or Carolyn?
I'd love to know more about the data that you could potentially have to answer some of these questions, because I think it's really interesting.
Yeah, I mean, I'm talking mainly about the health admin data. So, but I think when Danica and I spoke, we spoke about a cross-provincial approach. So I think we'll have to do some thinking in that area too, to think about how we can get data from different sources other than just Alberta.
So we did have a conversation with Fraser Health, and they are interested in identifying research questions that they can answer, and that people might be able to use their data. And as a sort of infectious disease model or transmission dynamics, how do we stop transmission? It wasn't obvious to me, but they do have administrative healthcare data, and I wonder if their data might be able to help you. It's more about, I think, the patient trajectory through the system than about, you know, what did we try to do to prevent transmission and did it work, which is, you know, something that I would be really close to my heart, but it's not as much what they have. So when you say administrative data, what do you mean? And is it I guess you can't tell me if the type of data Fraser Health has, but if I know more about it, then when I find out more about what they have, I will be able to triangulate and see if it's connected.
Yeah, and I mean, I think it probably is quite similar. I don't know their sources, but it's like the number of people who were, or not the number, each individual hospitalized case and why they were hospitalized and all the different surgeries that went ahead and procedures and what people were diagnosed for. So those types. So any kind of contact with the healthcare system. So it would, and there are people who know this a lot better than I do. But so I think in terms of hospitalizations, ICUs, and then there would be like physician billing. So that would give you a sense of what people are going to their physician for.
Okay, and then if you have that, I really loved the presentation, Danica, and I did have to step out for 5 minutes, so I might have missed this. But I guess I'd love to be a little more concrete on, if you had those data, what would you do that would answer one of the research gaps that you identified?
Well, one of the things I know we're talking about, and again, Danica, feel free to jump in here, not directly related to this project, but in other work, is looking at what, it's kind of similar to what an epi would do, and looking at what you would expect to see. So what type of procedures would you expect to see in a population throughout the pandemic, and what we saw, so we can get a sense of how many procedures were actually kind of missed during the pandemic, and where they were, like where is the biggest gap, and which of these might have the biggest impact on future health. So that's just one kind of example. I don't know if you have anything else to add to that, Danica.
Yeah, and we also want to we want to look at, try to estimate changes within the broader economy, specifically in the labor market. So we're going to look at modeling, like connecting an epi and economic model to help us fill some of that gap. But in terms of specifics of exactly where we're going from here, a lot of it's going to be shaped by what we see in the expansion of our scoping review. So say we find in a lot of other countries, a lot of these research gaps have actually been filled, then maybe we'll tweak a little bit on where we're going to go from here. But this is the idea at this point.
Cool, thanks.
Eric, you've raised your hand.
Yeah, thanks. One of the issues about administrative data is it's not always linked to the kinds of questions that we're trying to ask or answer. I'm wondering if there is value in our network or in stimulating other research units throughout the country to ask questions such as, did virtual care actually have an economic impact on workers' productivity? Because instead of having to take half a day off work to take, let's say I'm a woman working in the workforce and I've got 2 young kids and I have to take them in to see the doctor, and that's a half a day of my work gone. Instead, now I can do a virtual visit that makes it much more efficient and effective. And I don't have to take all that time off while I'm also working virtually at home. Potentially, it's 15 minutes of my day instead. Does that have a difference on the labor market writ large and on economic productivity? And that's not an advertisement for virtual care. There are some really strong advantages and disadvantages regarding quality, et cetera, and continuity of care in virtual care. But is that the kind of approach so we can actually target a question and initiate some research about that rather than relying on administrative data?
Yeah, I mean, I think it would be a great topic, and you could even expand it, I think, to look at where might you get the kind of, I hate using this term, but biggest bang for your buck without as many risks. And so, what areas, maybe it is, people with children, or maybe it's not, because you worry about not being able to follow up with them. I know, Danica, there was a paper you mentioned that wasn't a Canadian paper that was concerned about, I can't remember, like child abuse or something, and not having the chance to connect in that way. So I think it would be a really interesting topic, and something you could explore, not using admin data, but collecting, other types of data.
Okay, we have another question. It's on a different topic, really, but quite different. When you were discussing research gaps, could you elaborate on your thinking on funding purchasing of vaccines, drugs, and tests? What current challenges were you thinking about in particular, and what changes do you envision? So, Ellen, do you want to have a crack at that?
Yeah, I mean, I think, and it had kind of started happening with vaccines right before the pandemic. There was some purchasing at a federal level to reduce to help reduce, to increase your purchasing power, and therefore reduce the costs associated with the vaccines. I think rotavirus was the one that happened with. So I think there, and then it kind of really was pushed into the forefront when, you know, we had to move more quickly. We had to get purchases done a long time before it was available. And so I think this created opportunities for the federal purchasing, created opportunities for provinces, and made it slightly easier for them. So I think we need to start, I think it's just something that we would want to explore and see if this was possible at a higher level outside of COVID-19. So I'm not sure I fully answered that question, but.
Thanks for that. So John Sproul has asked, is there any potential to examine healthcare not delivered that ended up not being, not contributing to the care deficit? So can we look at evidence of revealed low value care? Is that something you've thought about?
I actually have not thought about that, but I that is not something that I saw in the literature at all so far. So, I mean, that's a really important gap, I guess, as well. What could be shaved off? What resources can be moved elsewhere without having a big deficit arise?
Thank you.
I think
So
Eric might have a response to that.
Yeah, and I just written something back to John, but thanks for that question. And it has been discussed recently. There's been some gray literature and some other literature around the effort across Canada, choosing wisely as an example, how to actually quantify those things that we're now showing actually maybe weren't needed in the first place, and how we might be able to support that drive or that push to stop doing things of low value.
Thanks, Eric. That's great. So we've almost run out of time. First of all, I'd like to thank Ellen and Danica for a really interesting presentation, and for all the participants for the questions and the comments. That's really enriched it for all of us. So thank you very much. Just to let you know that the next seminar is going to be on March the 24th, which will be 2 p.m. our time, which is going to be transportation, from the transportation team. And the seminar is entitled Not a Monolith, Transportation and the Pandemic. And if any of you have any further follow-on questions, you can email them to us at the One Society Network at ieche.ca. And if you are interested in collaborating with the network, then please visit our webpage at onesocietynetwork.ca/partners to sign up, where you'll get news of upcoming events, learn more about our research, and have opportunities to reach out to have conversations with members of the network about possible collaborations. That wraps up today's webinar. So thank you very much to everyone, and especially to our participants, to our presenters, and have a great day.
Thank you. Bye.